Hello, good evening, everyone. My name is Rebecca Marshall. Normally you hear me in the morning on Portland's Morning News, but we are here tonight for a special event. About a month ago, most of us had never heard of coronavirus. Corona was a beer, right? Now you can't turn on any newscast without hearing about coronavirus. A lot of people are concerned about it. We want to know what it is. Should we be concerned about it? And hopefully tonight we'll answer some of those questions for you. I've got a wonderful panel of medical experts here with us tonight. And they're going to introduce themselves here in just a second, but I was checking the stats on this because they change, it seems, every hour. At last check, we have 1,400 dead from the coronavirus. This is worldwide. It's important that we indicate that. Over 48,000 infected, 15 cases in the United States, and none here in Oregon. But we still want to break it on down, so let me have our guests here introduce themselves. Go ahead, please, Sarah.
I'm Sarah McCall. I'm a nurse epidemiologist with the Communicable Disease Services team at Multnomah County Health Department.
Hi, I'm Dr. Steve Krager. I'm the Deputy Health Officer for Clark County, Washington, as well as a few other smaller counties in Southwest Washington.
Hi, I'm John Towns. I'm the Medical Director for Infection Prevention and Control at Oregon Health and Science University and the Interim Division Head for Infectious Diseases.
And I'm Richard Lehman. I'm a public health physician with Oregon Public Health Division.
Got to start with the most obvious question. I think this might be for you, Dr. Towns. What is coronavirus?
Well, coronavirus is a virus in a group of viruses called coronaviruses, and for the longest time, there have been only 4 coronaviruses, or species, you might call them, of coronaviruses, and and they typically cause very mild symptoms, common cold-like symptoms. Around 2003, a new coronavirus came about, and that was called SARS, Severe Acute Respiratory Syndrome virus. It had developed the ability to attack the lung as well as the upper respiratory tract, so not just a common cold, but a severe kind of pneumonia, and that caused real panic in 2003. And then a few years later, another new coronavirus came along, and that was called MERS, or the Middle East Respiratory Syndrome virus, transmitted from camels to people and then between people. Both of those outbreaks, the MERS outbreak and the SARS outbreak, seem to blossom and then go away. And we haven't heard much about coronaviruses since MERS came on the scene until this outbreak, which is caused by a coronavirus that's very similar to the SARS coronavirus that can cause a severe pneumonia. So it's in that family of viruses that typically cause common cold, but has developed the ability to attack the lung and cause severe illness.
In terms of names, I've now seen it called novel coronavirus. I've also seen it called, was it COVID-19? Why these different?
Well, yeah, that's brand new.
Yeah, they're calling it now SARS-CoV-2, which is the virus that causes COVID-19. So
well, that's simple. Did everybody get that?
Coronavirus disease 2019. That's how they named it. But the virus is very similar to, almost identical to the SARS virus, but not quite the same. So they're calling it SARS-CoV-2.
I'll ask all you guys questions, but I'll go back to you. Are you concerned about this? I mean, what does the medical community think about this?
Well, I think, this is obviously causing a severe epidemic in China, and lots of people are dying in China, so it's something that really piques your attention. On the other hand, we've had very limited, if any, transmission in the United States. And around the world, transmission has been very limited. Most of the cases are imported from China. So the public health response has been very swift and has been able to, so far, contain spread of the virus outside of China.
We'll get to that for sure. Let's talk about symptoms, because I think anybody who has a sneeze out there is thinking, oh, could this be me? Who wants to tackle symptoms?
I could probably handle that one. So with this novel coronavirus, if we want to call it that, typically folks do have fever, and some people seem to have fairly mild symptoms, but as John said, some people have more severe symptoms and it can cause infection in the lungs, and that usually shows up with cough and shortness of breath. So those are the main things: fever, cough, and shortness of breath.
I'd also seen kidney failure. I didn't understand that. How do the kidneys play a role?
Yeah, there are some other things that have been seen here and there, but they do not seem to be as common. They do not seem to be as common as those symptoms that we just talked about. And I think John made a very good point as well. We don't have any cases of this here, and we're taking steps in order to try to prevent that from happening. We can't promise that we can keep it away completely, but we're taking steps to limit the spread of this and limit the likelihood that we're going to get any cases here.
Let me comment on the kidney failure thing. I think, there's what the virus does to you, but then there's also what your own body's immune response does to you. So, and that there's quite a lot of variation from one person to another in terms of the kind of inflammatory response or inflammation, how you get rid of the virus. And some people seem to have a very exaggerated immune response. And what causes that, we don't really know. But when you have that big time inflammatory response, sometimes that can cause shock. And the low blood pressure probably is what would cause renal failure, just from having shock and low blood pressure.
Yeah.
But we don't really know all of the details of what causes all of the end organ damage, but it's probably mostly due to low blood pressure and shock.
It does seem like most of the folks in China who have very severe disease are folks who are a little older. I'm not going to say old, given my age.
Don't you do it.
But
Don't say
but,
it.
Yeah, but
They're
the
our
average,
age.
yeah,
They're our age.
the average age is 59, based on a study of 425 folks who had this. And in general, a lot of folks had some other underlying health condition that may have put them at more risk for more severe illness.
That is often the case, isn't it? Dr. Krager, maybe you can talk a little bit about how you get it, or more importantly, how you don't get it. How contagious is this?
Yeah, that's a great question. So one of the things that we're trying to find out is exactly how contagious it is. So it seems to be similar to the flu, influenza, in terms of kind of how contagious it is. We know that it can be spread person to person. First, it seemed to come from animals, is what we think, perhaps a bat, but now obviously person to person. And it does seem to be close contact with a person. So, for example, there's the measles virus. So the measles virus is extremely contagious. And even just being in the same room as someone with measles, and if you're not immune and you don't have the measles vaccine, you would be at risk. That doesn't seem to be the case with this. It seems mostly closer contact, but again, that's something we're trying to find out.
Would that be like if I had it and I wipe my nose and touch the door? I'm sorry to be crass, but
No.
But is it like that actual,
That's possible. It seems more often it's someone coughing and you're right next to them. We're not sure about surfaces. How much transmission is occurring from a doorknob or some other surface that you touch and then someone else touches. It's likely that that's possible, but that's probably not happening as often as people coughing, sneezing, and spreading it that way.
Yeah, if there's someone who's ill with this and they're coughing and you're within, say, 4 to 6 feet, then there's a chance if you get hit by the cough and you're not protected otherwise, you could get exposed.
So there's two factors in terms of how contagious something is. One is how efficiently it's transferred from one person to another. And then the other is how long that person is contagious for. So now measles, for example, is extremely easily transmitted by small little droplets that hang in the air for hours. This seems to be transmitted not quite as efficiently as that, probably from large droplets that you cough out. But people may be relatively low, no symptoms for several days before they realize they're sick, and they may be transmitting during that time.
Isn't that the trick with all viruses, though? That seems to be a common theme. You have it, but you don't know you have it, and then it shows up.
Or you feel, I don't feel so good today. I had a little stomach ache. My nose is a little stuffy, and you're not sick enough to stay home, and you go and do whatever you're going to do. And at that point, you may be transmitting a virus, especially if you're a person who doesn't wash your hands, or you don't practice good respiratory hygiene, meaning you don't cough into your sleeve, you don't wash your hands after you blow your nose. Those are people who we call super spreaders. Don't be a super spreader.
I bet you have a bumper sticker that says,
Yeah.
wash your hands.
Don't be a super spreader.
Don't be a super spreader.
Yeah.
We talked a little bit about perception, because I think we'll get to the media's role in all of this. I think that's important. We don't want to say the sky is falling, but we also don't want to, put our head in the sand about it either. Sarah, you work the front lines, and I was curious, you field those calls, you have people come in. Are people concerned about this?
The short answer is yes. I work with a team, and we are available to answer questions from the public on any infectious disease. But obviously, a lot of our calls recently are about this new virus because it's new. It's scary when people don't know. And we get a lot of questions of people, I was around someone who may or may not have been from China, and now I don't feel good. Did they give me the virus? And it's really our job to make sure people have the right information that, the real risk for this virus is travel. It's not ethnicity, it's travel. And making sure that people understand that and don't stigmatize people, based on perceived country of origin, that it's really travel is the risk of getting this disease.
Dr. Towns, I think you said that in an earlier interview. You said it's more likely that we will take influenza to another country than we bring back coronavirus to this country.
Right, yeah. We have millions of cases of influenza in the United States. Yet who's talking about that? We're talking about coronavirus. You're
It's
more
just
at
not
risk of getting
scary
influenza
anymore.
than you are getting, if you went to Wuhan, getting coronavirus.
We do get desensitized, but I also have to say, when we talk about viruses coming from a camel or I don't know if this came from an open food mart. That's the other thing. I don't know exactly where this started. Do you guys have a better idea about where's ground zero? Not just the city, but the place?
Well, the thought is that there was probably one or two or a few events where the virus jumped from one species to humans, and it may have jumped or combined in an animal reservoir, like between bats, and some people are saying now pangolins may be the animal, that because the virus has been isolated in pangolins. Pangolins are like these anteater
with
like
scales
with
on them.
scales, and they're used in Chinese medicine, but they're illegally sold in these wet markets. So that may be, or it could be directly from bats. But so bats, I guess, are able to hang on to lots and lots of different coronaviruses, and these viruses are good at mutating and changing and recombining with each other. And so the bats aren't sick, but if you eat the bat, or you get blood from the bat, or feces from the bat, and you eat it, or you rub it in your eye, then you could get coronavirus, and then it gets spread from one person to another.
That's it. No bats for me.
No bats.
How long?
Or pangolins either.
Or
right?
pangolins. How long does it live outside the body? You spoke of the measles, it kind of hanging in the air for hours. What about this?
We don't have a lot of evidence that it lasts for very long. It appears to be kind of a wimpy virus, actually, in terms of its ability to live on a surface, and that's pretty consistent with what we've seen with other coronaviruses. So if you wash your hands, that'll get rid of it. If you use an alcohol-based hand sanitizer, that'll kill it. And it's unlikely to be living for an extended period on surfaces.
This is unlike, this virus is an enveloped virus. It has a envelope that regular detergents will break open and so kill the virus. Unlike, say, norovirus that causes vomiting and diarrhea, that virus is very hardy and lives in the environment for weeks and very difficult to get rid of, and you need to use bleach. This is not one of those. This is a virus that's killed by regular household detergents and cleansers.
If you want, we could have our next session about norovirus. But
No, that's okay. But that is so it doesn't. So the idea would be. I read a headline that said we'll be dealing with this well into next year, and I thought, really, because it sounds to me like you sort of said it kind of flares up and then it goes away. Which is it? Do we not? We just don't know.
I don't think we know. Yeah, it's something we're watching very closely. Obviously, what's happening in China is concerning, but and it's possible because some viruses are seasonal. That this could be a seasonal virus as well. Could be worse during the winter and better during the summer. But again, it's something we don't know for sure.
You two are on the front lines more, so I would say I don't know if that's the right terminology, but how? So let's play pretend. Let's say I come in and I think I have it. What process would you go through with me if I came into one of your clinics?
Well, we do a lot of our work over the phone. So let's say we fielded a call from a physician or a person who was concerned that they had it. We would assess the risk, ask about travel, because there's very specific criteria that has to be met before people can be tested for this. And it's coordinated through local public health with our state partners to get tests when someone meets the testing criteria. But we ask about travel to China or Hubei province. And we ask about symptoms because they need to have some of the symptoms, that Dr. Lehman mentioned earlier. And then we would work to make sure that people get tested in a safe way that doesn't expose other people, including healthcare workers, and make sure people get medical care if they need it.
A lot of the media's covered the couple Frasers that are from Forest Grove. They're on the ship, and we know that they're getting swabbed every day, the back of the throat, which is how they test them. But is that the only way they test them?
No, there's it's called an NP or nasopharyngeal swab. They stick it up your nose and tickle your brain. It's similar to flu. They can
Not
swab the
really.
back of your throat.
Not really.
Tickle.
Not your brain.
And sputum, so making you cough up things from your lungs.
Do you have the same phone calls and experiences as well?
Exactly. So in Clark County, we don't have a clinic, so we are mostly fielding calls from local clinics and hospitals, and sometimes just concerned citizens. One of the things that we have focused on a lot is helping those hospitals and clinics prepare. So making sure that they have processes in place, making sure they are asking those same questions. Have you traveled recently? If you have a cough, let's get a mask on you, because that's good practice kind of regardless of whether it's coronavirus or not. So we've done a lot of communication and just making sure that hospitals have the materials that they need: masks, gloves, gowns, eye protection, and that sort of thing.
Dr. Lehman, as I understand, you are playing a big role, if not in charge of the statewide response to something like this. Is that correct?
well, I'm not in charge of it, but I'm part of the team.
Okay. So are you confident that we have a grasp on not just this, but other kinds of things that might come to the state?
This is something public health deals with every day, and we deal with outbreaks of gastroenteritis, the kind of thing that Dr. Towns was talking about. We deal with outbreaks of measles, which goodness only knows poor Clark County was dealing with not so very long ago. This is just the mainstay of what we do. So we are working with local public health. We're working with the CDC in order to know when folks are coming who might be at risk, and then local health departments, bless them, are working with those people in order to make sure they know what to do in case they do get sick. Most of them are not going to get sick, but in case they do get sick, they'll know what to do. They can get care promptly, and they can do it in a way that won't infect others.
You know, we've had a lot more experience over the last 20 years or so. It started with, from my perspective, anthrax that was a big deal, and then it was SARS, and then it was MERS, and then it was pandemic flu, and so it's not like this is his first rodeo. They've been doing this a long time.
And actually, Dr. Towns used to be with us over at the Public Health Division.
So it's not your first rodeo
No.
either. Are you learning from China what to do, what not to do? What's your observations of China and how the country's handling it?
Do you want?
Well, one thing is, I'm not too sure about the infection control in hospitals there, because one of the things that has been reported is that a large number of the cases are acquired in the hospital. So that may account for the increased mortality rate they're seeing. Of the people who've had coronavirus outside of China, the death rate is 0.02% or something, 1 death or 2 deaths out of all of the cases, 500 or so cases outside of China. So they're doing something there that is amplifying the severity of illness, and I'm not sure exactly what that is. I know that a lot of people are getting or have gotten treatment with corticosteroids in the hospital, and that's probably something that we should discourage of our providers from giving steroids to people who have this virus. But in terms of the public health response, I think maybe you can comment better on that.
Well, I was just going to say, so sometimes you learn what to do, and sometimes you learn what not to do when you observe what happens. And I think, China is dealing with a very difficult situation. They actually were presented with sort of a perfect storm, if you will, because this virus began spreading in Wuhan. It's a city of 11 million people, and it was right at Lunar New Year, which is the time that everybody is traveling all over the
It's
country.
a transportation hub
So,
for the country.
yeah, and so that unfortunately, I think, led to a lot of people being exposed in a country of 1.4 billion people in a short period of time, and that's challenging. But I think one thing that, as Dr. Towns mentioned, one thing that we learned, and we learned this with SARS as well, that you need to take the appropriate precautions when you're taking care of patients. And you need, if we do have patients, we need to put them in the appropriate precautions, as we call it. That is, they need to be in a place where they will not infect staff, where they will not infect visitors, and where they will not infect other patients. And it may have been very difficult for China at the beginning of this to do that because they didn't know what they were dealing with. Mm-hmm. Now we're beginning to get a better understanding.
So ideally, it would be for people who were sick with this to stay home, unless they were, feeling like they might be dying or something, right?
I love that message.
Stay home.
Or at least don't just show up with a runny nose and a cough. Call in advance to your provider and say, I think I have a virus and I'm coughing. How can I be seen in a safe way to prevent transmitting this virus to other people in the clinic?
Right. Can I just
Sure.
add? And so when I say stay home, I think once, say, you've gone in or you've decided, oh, I do have influenza or I do have this or that. You hear this all the time from us, but we say it because it works. If you wash your hands, if you cover your cough if you are actively ill, and when you're actively ill, if you can, stay home until you're better. Because if you can do those things, we will greatly decrease the amount of illness that we see from influenza or from any of these communicable illnesses.
So the bumper sticker is wash your hands and stay home. What
And
about...
don't be a super spreader.
And don't be a super
That's
spreader.
right.
I forgot the third one. Thank you.
That's the other bumper sticker.
What do you think about the Purell and other hand sanitizers? They're everywhere. I use them if I'm not right by soap. Are those okay?
they're better than nothing for sure. Washing your hands is still best. So for a decent amount of time, getting a good lather and washing, the front and back of your hands. But yeah, just walking around, if you see hand sanitizer and it's been a little while since washing your hands, it's certainly not going to hurt.
One thing you have to be careful of is to make sure that the hand sanitizer has at least 60% alcohol.
Right.
Because that's the thing that breaks open the envelope of the virus and kills it.
Yeah, and because this is an envelope virus, if you use that 60% or greater alcohol hand rub, that's probably going to do the job.
The only thing is you have to make sure your hands aren't visibly soiled. I mean, if you've got junk on your hands, dirt, blood, whatever on your hands, you have to wash that with soap and water.
Can you clarify envelope virus to regular old virus?
Well, yeah. So, a virus is usually made up of DNA or RNA with a coat around it, and then sometimes an envelope made out of lipid or fat layer, and a membrane kind of thing. And so the coronavirus is an RNA virus, and it has a lipid membrane or coating. And if you hit it with alcohol, it breaks it open and kills it.
I want to do a reset. I thought we would do this. If you're just joining us, either on the radio, hello radio friends, or on the live stream here, we are talking about the coronavirus tonight because a lot of people are concerned and there have been a lot of questions. We wanted to get to the bottom of it. And we want to thank OHSU Health for bringing this to us. I want to reintroduce our panel, and I'm going to hope I get all your names right, or not your names, but your titles. Dr. Richard Lehman, I'll go in order. Let me go in order. Sarah McCall here, the lead communicable disease nurse on the County Public Health Coronavirus Response Team and nurse epidemiologist.
Very good.
Thank you. Clark County Public Health, Dr. Steve Krager, Clark County Deputy Health Officer. Thank you for being here.
Thank you.
Dr. John Towns from OHSU, Medical Director of OHSU's Infection Prevention and Control and Interim Head of OHSU's Infection Disease Division. And Dr. Richard Lehman from the Oregon Health Authority. Lehman.
It's definitely Lehman.
Public health physician.
Thanks, and glad to be here.
Public health physician in the Acute and Communicable Disease Prevention Program. Thank you all really for being here.
Thank you.
I really appreciate it, and I think all of our viewers and listeners do as well. Treatment. What happens if you get coronavirus? Do you just ride it out, or what do you do?
Well, right now, you're not likely to get it because we don't have it here. But this is something that we don't have a specific medication for, and so treatment is supportive. So we basically are helping the person to get through the symptoms that they're having until the immune system that Dr. Towns was talking about kicks in, you make antibodies, and you kill that virus.
There are a couple of antiviral drugs that are being tried. I know the first case that was in Washington, I think, has been treated with an experimental antiviral drug. And he recovered. He probably would have recovered anyway. And so I think those clinical trials are going to get going here pretty soon. It's really amazing about this virus how we're prepared now compared to where we were 20 years ago. In this case, they discovered this new virus. Within a week or two, they've got the genetic sequence of the virus. They've got it cloned and distributed to vaccine manufacturers and drug developers. And scientists all over the world are working on it. And within weeks, it's amazing. And so, I think probably in the next year, we'll have an antiviral medication, hopefully, that is effective against it. And the benefit is that may be useful for other viruses as well. So that's the silver lining, perhaps, in this, that there may be more drug development as a result of this.
We take these things for granted. I mean, that's amazing what you just said there, because there was a time when the flu would kill, millions, right? Or hundreds and hundreds of thousands. So
Millions, yeah.
I mean, that's just, so we should be very grateful for the progress that we're making. Fever, is a fever good or bad? Do you want to fight a fever, or do you want to let the fever flare up? I know it's not here, but let's just say if it was, or for
Feed
the
a
people who are
cold,
sick.
starve a fever, I think. No, I don't know. There's a commercial.
But I saw some video of people with the cold compress on them when their fever was flaring up. Do you want to try to suppress the fever, or how does that work?
Suppressing fever is probably makes you feel better, but it probably doesn't have any bearing on the overall outcome.
Yeah, so
So it's probably okay to do.
I would agree. I think that that's driven by comfort, and we don't think that it has an effect one way or the other on whether that's going to make you get better that much quicker.
The one thing that you have to be careful with fever reducers like acetaminophen and ibuprofen, the common names are Tylenol and Advil or Motrin, is that sometimes if you have baseline kidney disease and you take ibuprofen, that or high blood pressure, that can be a bad thing because you can really cause damage to your kidneys. And if you're drinking alcohol, you don't want to take Tylenol because that can cause liver problems. So, in moderation, those things are okay for a short time, but taking them for a long period of time or with alcohol is definitely a no-no.
You mentioned vaccine, and somebody had asked me, if I get the flu vaccine now, will that help if they prevent any kind of problem with coronavirus? I don't think it would, but I wanted to ask.
We don't think it will help against coronavirus. We think it will help against flu.
And how do you deal with that? You must. We talked about public perception a little bit, and I thought a big chunk of your job would be to tell people to inform them or disinform them of things that they think they know. How big of a struggle is that, or a challenge is that for you as medical professionals?
I mean, I think, we try to emphasize the fact, there are no cases in Oregon. The risk is quite low to our population. And just emphasizing that there is greater risk at this point for other respiratory illnesses like influenza, whooping cough, all kinds of things. And I think it helps put it into perspective for people to realize, this novel coronavirus, while it's scary because it's new and we're still learning about it, the bigger risk for our population right now are things that are already here, like influenza and whooping cough.
Yeah, I mean, it used to be that we told people to get influenza vaccine if they had other conditions. Older people or people with diabetes or heart failure, those should definitely get flu vaccine. But a few years ago, we realized that really everybody should get the flu vaccine because the more people we vaccinate, the less transmission we're going to have. So really, everybody should be vaccinated for influenza, and then we will have, if we have an immune population or the largest part of the population is immune, we'll have a much better flu season with less cases of flu, fewer hospitalizations, fewer complications from flu. But it's hard to get that message out. I think a lot of people don't want to get a shot.
Because it gives you the flu.
Yeah.
No,
Well,
it doesn't. It doesn't.
A flu vaccine can make you feel a little punky for a day, but it's way better than having influenza. If you've ever had influenza,
It is no picnic.
No.
And actually, I think you raise a good point. I mean, it's challenging sometimes to get the message out, and that's why I think we appreciate this opportunity to share information with people. And actually, Ms. McCall and I have been going on the road a bit and giving talks in various settings just to try to give people that information and give them a chance to get their questions answered.
Because, right now, because there are no cases in Oregon, our biggest job is preparing, getting ready, but then also making sure that communities have the information they need. For example, my team, Communicable Disease Services, we are really good at talking about incubation periods and infectiousness and all that technical stuff, but we don't always know the best way to get the message out or who needs it. So we've been partnering with other programs at the health department, like our community partnerships team, They have connections in the community with, Asian American organizations, Slavic, a lot of different groups, and we're working with them to figure out who needs what information, how do they want to receive it, and how can we best support them. Because especially our Asian American communities, they're seeing a lot of information from over in China and Hong Kong and all those countries, and they're scared. They're scared because they have friends over there, they have family who are in the thick of it. And so I think part of our response, too, is supporting that, the mental health piece of it and making sure people have the right information and the right support.
You're nodding your head. Same for you, huh?
Absolutely, yeah. Just going back to kind of like misinformation, there's a lot that gets spread on social media sites, and I would just tell people to go to trusted sources of information. So your local physician or provider is a trusted source. The CDC is a trusted source. In Oregon, it's OHA, or the Oregon Health Authority. In Washington, it's the Department of Health. And we do our best to provide information that is, easy to understand and is accurate. Yeah.
And also, you talked, I want to circle back around to the fact that the coronavirus, and I hope I got this right, in and of itself isn't particularly deadly. It just seems to be more deadly in China by the way that they've put the people together that came down with it?
It definitely can cause serious illness, that's for sure. The question is what proportion of the whole have such serious illness? That's really true of a lot of viruses, not just coronavirus. The question is how many people have been infected we don't know about and have mild illness? That's the real question. So we know that there's 44,000 cases that have been diagnosed, but how many people have infection and never really have much of any symptoms at all? So if it's 1,000 deaths out of 44,000, that's pretty bad. Worse than flu, but if it's 1,000 cases out of 1 million, it's maybe not really as bad as flu. So, so we don't really know.
Yeah, I was just going to say it's very understandable that in China they would be doing their best to take care of people who are very sick. And that's probably also the people who, particularly early in this outbreak, were the ones that were getting tested, and where we know that those are cases. So it may be that there are more folks who have milder illness with this particular infection, and that's one of the things we're still learning.
We do a lot in the hospital to try to prevent respiratory virus transmission during respiratory virus season, because if a person who's hospitalized for a heart attack or a stroke gets influenza in the hospital, their mortality increases substantially. So the same is probably true of coronavirus. A lot of those people, the spread or the epidemic spread, a lot of it is occurring in hospitals in China. So I think some of the people who are getting ill are dying because they have so many other problems at the same time.
You had mentioned you guys have been driving around like at the state talking to people. Does something, Dr. Lehman, stand out to you that people have said that you thought maybe this is either way off or this is a common misconception? Let's share this with the rest of the public. Is anything stuck in your head about that?
Well, I have had a couple of times that people have said, I went in to see my doctor and they tested me and I was positive for coronavirus. and as Dr. Towns had mentioned, there are 7 coronaviruses that cause infection in people. 3 of them we think can cause pretty severe disease. The other ones tend not to cause severe disease. Rarely they might, but they're much less likely to. And the test that is readily available in clinical labs in Oregon can test for a coronavirus, but not this coronavirus. And the test that's out there right now would not test positive for this particular coronavirus because it is so different from the ones that usually circulate.
That's an important distinction. Wow. I think we could all learn from that one, don't you think? Yeah. I thought maybe
I was just thinking of why is it called coronavirus? I think maybe people want to know because it has these proteins that stick off the surface that make it look like it has a crown. So they call it corona because that's the name for a crown, right? And so that crown is detected by a test. If the crown is different, the test won't pick it up. So this coronavirus has a different crown, you might say.
And I was just saying, going to the misconceptions or things. I mean, we've heard rumors that people won't go to Chinese restaurants to eat because of fears, and I just want to say it's fine to do that. Please don't avoid interacting with, people that appear to be from China. I think Dr. Lehman had a great response when someone asked us, well, what if I meet someone from China? What should I do? And he said, say hello. Right? Because that's a big part of our job is making sure people understand the true risk. There are no cases in Oregon. Travel is the risk. And, there's no need to discriminate based on perceived country of origin.
Anything that I'm missing? You're the experts here. I'm afraid I might not be asking the one question why didn't she ask me that question? Is there one that you can think of?
I think it'd be interesting just to talk about what would happen if we did have a case in Oregon or Washington, and kind of what the public health response would look like. It's possible. We already had one in Washington, so we have that kind of as a model. So we treat it like we do with a lot of other infectious diseases that are kind of public health concern. So trying to get the person tested as quickly as possible, isolating them and keeping them safe and the people around them while we're waiting for that test. And then if it's positive, then it's a lot of investigation. So a lot of work that you do on a day-to-day basis where it's finding out exactly where that person went, over the last however many days. We want to look back 5 to 10 days, whenever they might have been infectious, and then trying to find, the close contacts with that person. And then after that, we closely monitor those close contacts and watch them for symptoms. So in Clark, what we would likely do is either a call or a text kind of every day. So, all right, do you have a fever today? Have you had any symptoms today? And if that was positive, then we would go further. So this is something we do a lot. I think Dr. Lehman kind of mentioned that this isn't like a new process. So I think we are kind of prepared for if something like that happens, and just the fact that the U.S. hasn't had significant spread, I think, again, goes to show that the public health system is working here.
Yeah, and we do it because it works. And so Ms. McCall has been involved in contact investigations, as we call it, doing just what was mentioned. And actually, if people are interested, we have a video on our website where you can learn how to do a contact investigation if you want to know what public health is going to do.
Yeah, I just want to say, my team, this is the work we do every day I think there's 110 reportable illnesses in Oregon, something like that we could theoretically investigate. And this is what we do. We develop a rapport with people. We get to know them, and then we talk to them. We ask them specific questions. Where were you? Who are you with? We talk to them about their contacts. We assess their risk. And if we think people are at, increased risk of developing disease, we'll often ask them to stay home when they could potentially be incubating that, so that if they do develop symptoms, they aren't out in the public potentially infecting other people. And we've had really good success of people working with us because we developed those relationships with them.
I would think with the coronavirus, the one differentiating thing would be where have you been, where have you traveled? Because I would think these symptoms, at least in the onset, would seem very familiar.
That is the case now. And the real question is whether we're going to have any transmission here that is not travel associated. We have not yet seen that in the United States, but it may come. And so I think the point is, it's, we say there's very little risk now, there's very little risk. It's like being on the beach when you know that there's a hurricane that's off the coast of Africa, and it's coming. You don't know where it's going to go. You don't know whether it's going to go north or south, and it may not make landfall at all. But it's coming, and you really need to be prepared for that in case it does come. So I think it's possible that coronavirus is going to make landfall here and then be transmitted, and then it will be up to all of us, each individual, to help control it, to isolate themselves when they're sick.
Yeah, and if we do get into that situation, again, the things that work against flu are the things that will work against this novel coronavirus. So covering your cough, staying home when you're sick, and just washing your hands. And washing your hands even works for that norovirus that Dr. Towns was talking about. And I think this is why, because there is that possibility. We don't know for sure whether this may come to Oregon, but we plan to be prepared if it does. And that's why we're working with health systems, we're working with hospitals like OHSU, we're working across the border and staying in touch with our colleagues in Washington. We're working with the counties. We have guidance information for clinicians about what to do and for nurses and hospital staff about what to do in order to protect themselves and protect other patients. And we have this system in place so that if there are people who may be at risk, we can work with them, just the way Ms. McCall was talking about, in order to make sure that they are safe, their families are safe, and they can be taken care of if they do become sick.
That was one of the reasons we wanted to do this so quickly and thoroughly, because it's knowledge is power, and it's almost an insurance policy against when and if, or if the hurricane comes, or if the virus gets here, that we can at least hopefully touch some lives out there to say, how can I be responsible? Because really, at the end of the day, you people could do everything that you want to do, but it's that one person that has to be responsible with one's own body and family. Don't you agree? It really comes down to one person.
Yeah. Mm-hmm. So health in the community is a team sport.
I want to ask one more question. We've got a little bit more time. I was curious why they tested on the ship for the coronavirus every 2 hours. I think I heard them testing every 2 hours. Why so frequently?
To be honest, I hadn't heard they were testing every 2 hours.
They said they were knocking on the door and everything.
I think one thing that they were
Testing
doing.
their temperature maybe every 2 hours.
Yeah, oh, yeah.
And they're probably
that
trying to
may be.
collect some data so that we can understand the natural history of the disease. How long are people shedding virus for? And how does shedding virus correlate with their symptoms? I think that's probably what's going on.
Yeah.
I don't know.
And certainly in public health, if somebody has had an exposure and they are staying at home, they're doing a self-quarantine, they're not sick, we do encourage them to check their temperature twice a day so that we can know and they can know whether they do become ill. And then that way we know whether they need to be evaluated, and we can arrange for a way to do that safely.
Why don't we just go down the line and just give us that one takeaway that you would like people to take with them after this panel? We've got a few minutes left. If you want to start, what would be that one thing?
I think my biggest takeaway, it's not medical, it's the don't discriminate piece. The biggest risk for this disease is travel. It's not perceived country of origin.
Going off of that, I heard a good saying the other day. It was viruses don't discriminate, and we shouldn't discriminate either. The other thing I would say is it's not too late to get a flu vaccine. So if you really want to protect yourself, that's another thing you can do. And then keep a close eye on things. I mean, not too close, but with trusted sources of information. If you want to stay up to date, that's something you can do, and it's just a good idea to. Sorry.
Take your time. We've got like 7 or 8 more minutes.
Yeah, I could talk forever.
Do it.
Yeah, staying informed. I think knowledge is power, like you talked about, with those trusted sources of information.
Yeah, I think I'd like people to understand that the public health system in Oregon is really top notch, and in Washington as well, and that requires not only the dedication of the people that are there, but also funding. It requires funding to train infectious disease people. We don't really have enough funding to train new fellows, and we're always looking for new funding. But the government that we have is the government. It's us, and it's really a great group of people that are in your government, and you're getting good information from the government about this issue.
So novel coronavirus is not in Oregon. We have no cases of novel coronavirus in Oregon. We are all working together in public health and in the healthcare community in order to keep that from happening, if that is at all possible. And there may at some point be cases here, but we will continue to work in order to protect you, protect the community, and to minimize that spread. And one thing that you can do, just as you can do this for influenza, if we do get to the point where we do have novel coronavirus here, you can wash your hands, you can stay home when you're sick after you get evaluated, and that a doctor like Dr. Towns says, yep, you can be at home, and you can cover your cough. And if we just do those simple things, in addition to getting vaccinated against influenza, we can be a healthier community. And believe me, I have had influenza. It is no picnic.
I want to ask you so much more about that, but I'll ask you probably later. How's that? You said trusted resources, and I think that's really important. Can you name a few sites that you really trust for people to go get more information?
Multnomah County Health Department.
Good one.
We have our website, multco.us. Also, as I mentioned, my team, we have someone who answers the phone Monday through Friday, 8 through 5. We take physician reports, but we also take questions from the public, and we can provide that number for people. It's 503-988-3406, and I hope my team doesn't kill me for giving that number out.
Was that somebody's home number? Whose home number do you want to give out, Dr. Krager?
I'm not going to give out. I don't have those numbers memorized, so. I think the CDC has some really good information. If you just Google CDC coronavirus and go to their information for patients, it really lays it out, and they keep it updated. So that's what I would go to.
Yeah, the other source is the WHO. If you look at the WHO website, they have a situation update every day. So they give the new case counts every day from all over the world, and nice maps and things like that.
Yeah, and of course, I have to mention Oregon Public Health Division's website, and we have what we hope will be, we will continue to update it, and we've tried to make it one-stop shopping, so there's information for the public, there's information for the healthcare community, and there's information for local health departments and tribes.
I will try to put those on our website as well, so people can reach back for that as well. And I wanted to say again, thank you so much for coming out tonight, taking time out of your day to get this information out. I think it's really important, and I couldn't be more happy. So thank you very much.
Well, thank you for having us.
Thank you.
I'm Rebecca Marshall with Portland's Morning News. Thank you all for joining us tonight here on FM News 101 KXL.